First of all, a very warm welcome, everyone. We have joined here today for the World Albinism Awareness Day. And albinism is a genetic condition which affects the color of a person's eye, hair, and skin. Now, to discuss the medical, social, and mental aspect of albinism, we have with us three specialists. To start with, we have Dr. Parag M. Tamhankar. Dr. Parag is a senior consultant medical geneticist at MedGenome Labs, Bangalore, and Center for Medical Genetics, Mumbai, Jupiter Hospital. He's also an MD in pediatrics and MBBS from KEM Hospital, Mumbai. Previously, he has been a scientist at ICMR Genetic Research Center and a consultant to WHO. Now, we are also joined with Dr. Shailaja Tibrewal. Dr. Shailaja is a pediatric ophthalmologist with specialization in strabismus, neuro-ophthalmology, and ocular genetics. She's an alumnus of LVPEI Hyderabad, where she has also did her long-term fellowship in pediatric ophthalmology, strabismus, and neuro-ophthalmology. She has been associated with Dr. Sheroff's Charity Eye Hospital since 2013 in the Department of Pediatric Ophthalmology and is in charge of the Genetics Clinic, also at SCEH. We're also joined by Dr. Gunjan Verma, consultant dermatologist at Manipal Hospitals, Dwarka. She has an MD from Dr. Ram Manohar Lohia Hospital, New Delhi. She has also done her MBBS from Safdarjung Hospital, New Delhi. We can quickly get into the thick of things and know more about albinism. So my first question is open to the panel, and I will start with Dr. Gunjan. What are the various stereotypes, Dr. Gunjan, that are associated with albinism?
Yes, Shivam, first of all, thank you. And as we mark the International Albinism Awareness Day on the 13th of June, it's worth reflecting on the various stereotypes, which are, I would say, are terribly prevalent in our society, not only in India, in all over the world. There is something, there are some myths and superstitious associated with albinism or any disorders of hypopigmentation, even with generalized vitiligo or any other thing in which the skin colors or hair colors or eye color get lost because of the loss of melanin, the thing which is responsible for getting our skin tone, either dark skin or fair skin or any skin type from 1 to 6. When there is no pigment or very less of pigment, so your skin becomes white. So there are many stereotypes associated. Some people say they are from moon. Some people say they are cursed. Some people say they are sterile. They do not, give birth to the normal children. So I would like to say here that this is absolutely wrong. And people suffering from albinism is equivalent, can give to birth to a normal children. But yes, with some genetic counseling, with some other things that need to be advised by a professional, by a practitioner, so that these myths and these superstitious things can get away from all over India or all over the world.
Dr. Shailaja, would you like to add something to that?
Thank you once again, Business World, for giving me this opportunity to spread awareness about this disease. And as Dr. Gunjan rightly pointed out, lots of, in India, elsewhere, whenever a person is looking different or appearing different than the others, it adds to a social stigma. So these children also, when they look different, I have seen, in fact, a little bit opposite thing, like, in an Indian family, when a fair child is born, they're even more happier, thinking, oh, hamara bacha bahut gora hai, they think that it's, and sometimes then the other implications of the disease are neglected and they fail to accept that this is actually a problem and not just a fair skin, which they were happy about. So this is another, it's like an opposite kind of a stereotype, and they feel, it is just a skin color, but it is associated with other eye problems, which need to be taken care of, skin problems, as Dr. Gunjan will highlight later also. So it is important to realize that this is a problem. It is important to know that, yes, there is some treatment available for it, at least some amount of, rehabilitation in it, and then we have to keep monitoring these children for long.
Dr. Burma, how is albinism the prime cause of some forms of cancer, which is there is skin cancer and there is sunburn? The people who are with albinism condition, they're exposed to more sunburn. So
Yes.
talk us through that, the forms of cancer
Yes,
and the sunburn
definitely.
exposure.
See, albinism is prevalent. Like its prevalence is 1 in 20,000 in most of the population in all over the world. It is even seen in India, though it is much rare. It is more in Africans and Americans, and because color is getting white, so it is more visible in the people who are more dark. So there is no enzyme activity. So there is no melanin synthesis, but there are various subtypes of oculocutaneous albinism. We say, I'm using a medical term. So there are different types of it. In particularly tyrosinase negative OCA1A, what happens? There is no color. The skin is absolutely white. Their hair colors is blonde from the beginning, very beginning from the birth. And eye color is usually blue because there is no melanin in the iris. And with this particular type of oculocutaneous albinism, we call it OCA1A, there is no as such changes as the child mature or become adult. There is no change in the skin. The skin will remain white because there is no or null enzyme activity. But with the other types, there are few enzyme activities may present. So they may have some flocks of pigmentation. They may have some flock of pigment on their hair. With the sun exposing their skin, they may develop some freckling or some skin lesion later on. But yes, they are more prone to cancer. Sometimes there is delayed recognition in these cases. So what we should do, we should tell them ki if you notice any lesions that there are black colored spots, there are lentigo, solar lentigo, which are basically caused by sun, caused by UV radiation, and they are more prone in getting white skin individual or fair skin individual, and sometimes they lead to squamous cell carcinomas or melanoma. But delayed recognition may lead to early metastasis in some children. So it will lead to cancers and high mortality rate, and there will be high morbidity. So if we diagnose the condition from the birth, because we know that they are more prone to cancer, so what we can do, we can ask the families, their children, parents to come for regular skin checkups to know if there is any skin changes, if there is any thing, dark colored thing, if lentigo is developing on their skin, is there something, a growth or lump is there, if or not it is present. So we have to just counsel them because they are actually more prone to get cancers.
Coming to the recognition part, you mentioned, what are the various tests associated with diagnosing albinism?
See, the albinism is basically diagnosed by birth by just seeing the child. As such, we can only do genetic testing to find out which gene and the defect is present. And Dr. Parag will tell you more in details about the genetic testing. But as a clinician, when we encounter a child of albinism, we see there is white forelock of hairs, and there is white colored skin, no pigment. Her eyebrows and even eyelids are also white. Pale blue eye color we usually see with oculocutaneous albinism type 1. But with other type of albinism, we sometimes see there are temperature sensitive area. There is some color are there because after 35 degrees Celsius, the pigment start depleting. So there are few points in our body where the hair gets more color, and at few points hair may not get any color in future also. So this is only the clinical, I would say, by examination, and this is a clinical diagnosis by a dermatologist. But definitely genetic counseling and genetic testing is needed. We can send, if we are in any doubt, sometimes it is difficult to distinguish between oculocutaneous albinism and in only ocular albinism, in which there are no cutaneous finding, and there are various syndromes associated sometimes, And there are other congenital genetic disorders. There are various syndromes like Chidiac-Higashi and Hermansky-Pudlak. I would not like to go in very much in detail of them, but they can also present as hypopigmented disorders from the very beginning. And testing is to find out the association. If the child is having less visual acuity, then we will refer them to eye specialist, ophthalmologist for early detection of their eye changes. They can be myopia or hypermetropia or even nystagmus. There are many changes in eye. So we will have to see what tests need to be done in particular child as per their presentation also. As far as regarding skin is concerned, we ask them to come up for an annual examination so that we can see their skin and we can counsel them for what are the danger signs for developing some cancers.
Right. Coming to the genetics of the test associated with albinism, I will also want to ask the similar question to Dr. Parag as well. Dr. Parag, could you highlight some tests associated with diagnosing albinism?
As Dr. Gunjan has rightly pointed out, it is a spectrum of conditions. The most commonest is OCA type 1, which is caused by a gene called as TYR gene. So basically what happens is that there are mutation in this gene. A mutation is a spelling mistake in the gene. So what happens, these genes form, the DNA is responsible for forming a protein. So if the mutation is there in the gene, if there is a spelling mistake in the gene, then the protein will not function. So there are around 26 genes. Mutation in either of these genes can lead to albinism. So as Dr. Gunjan has also pointed out that there are other forms of albinism other than OCA type 1. So there are some extra cutaneous manifestations to that also. So she has pointed out that there is eye and skin manifestations, but there could be involvement of other systems also. So there is a syndrome called as Hermansky-Pudlak, where there is problem in bleeding tendency. So these are problems in the platelets, which are responsible for clotting of the blood. And there could be other immunodeficiencies in these patients. Then there is a syndrome called as Chidiac-Higashi, which is an immunodeficiency syndrome, and Griscelli syndrome, which is again an immunodeficiency syndrome. So these are the rarer forms of albinism. The most commonest type of albinism in the world is OCA type 1, which is because of mutation in TYR gene. Now, what is the inheritance pattern in these patients? So what happens is that these are autosomal recessive conditions. What is meant by autosomal recessive means two parents who are the parents of the child are carriers for the gene. So everybody of us has two copies of the gene. So if both the copies of the genes are mutated, then it is called as autosomal recessive disease. So each mutation comes from either parent, one from the mother and one from the father. So if the parents are carriers, they are minors or carriers for the gene, then there is a 25% recurrence risk in the child. So at every pregnancy, you can screen yourself for if there is a child with autism, you can diagnose by doing a DNA test. So what are the various DNA tests that are done to diagnose autism? There is a panel of tests. So because there is no single gene, you have to sequence many numbers of genes. So what we do is called as a panel testing. So the technology is called as next generation sequencing, where we put all the genes of albinism onto a chip and sequence the genes. So we come to know what exact type of albinism is there depending upon which gene is mutated. Yes, basically it is a blood test. You take out the DNA from the blood and then sequence these genes.
Talking about the health challenges that people with albinism face, what are some health challenges that you can point out?
Most important is vision. So Dr. Shailaja will of course
she can add to that.
Yeah, and as I said, there are other problems that are increased tendency to have sunburns. So because they have no melanin, the UV light is very dangerous to this.
I would like to add on that.
Sure.
Particularly said very important thing, and basically what will happen if any sun rays comes to my skin or your skin? What will happen to us? We will get tanned because of melanin. We have melanin in our body, so we will get tanned. But a person with suffering from albinism will not get tanned. He will simply get burned, because there is no such thing to that your cells are increasing, your all these things are not happening with you. So they are particularly get more chances if they go out in a hilly area where sun rays are coming directly to your skin. If you are going out in the peak hours, so what will happen? Their eyes and even yet their skin have more chances to get more amount of UV radiation, and there is more chances of blistering, bruising, and burning out of their skin.
Problem which Dr. Shailaja will talk about. The third is extracutaneous and extraocular manifestations is immunodeficiency. Some of these patients very rarely have immunodeficiencies, and hematological problems like platelet function defects.
Shivam, immunodeficiency means that they will have recurrent infections. That is what we ask them clinically. You know, when we are working up a child with albinism, there's two things that we ask is any lumps or any skin burn or any melanoma or any patch of hyperpigmentation on the skin if they have observed, or any bleeding tendencies or any history of recurrent infections. If those are there, then definitely the testing goes more in favor of these syndromes which Dr. Parag has been talking about. Now, coming to the eye problems, they will start from birth. The eye problems will start from birth along with the skin pigmentary problems, but the skin cancers and the problems which come later, the eye problems start right from birth. So there are a lot of eye problems which are there. Most commonly is a refractive error. They are more commonly having refractive error, especially astigmatism and hypermetropia. Now, refractive error is that the eye is not able to focus the rays into the retina. So they have like plus power, which is hypermetropia, and astigmatism, which acts in one axis. More commonly they have. And the second important thing is nystagmus. Now, depending upon the OCA type and the severity of the pigment loss, these problems are more, severe. Nystagmus is shaking of the eyeballs. Now, when the melanin is not there, I mean, the pigment is not there, there are also other changes that happen in the retinal development. It is seen that, dopamine, L-dopa, which is a intermediate in the pathway for this tyrosine melanin production, that helps in retinal development. So if that is also not there, so the retina is not developed, and the fovea, which is the center part of the retina from which the main vision forms, that is not developed in these children. Those who have the severe type of OCA1 more commonly. So when the fovea is not developed, the vision is very poor, and they also have the shaking of the eyeballs. Unfortunately, shaking of the eyeballs will not have any treatment. But yes, it can be reduced if we correct the refractive error. Apart from that, they also have more tendency to have strabismus, which is the crossing of the eyes or squinting of the eyes. And apart from that, they also have loss of stereoacuity. Stereoacuity is the binocular vision. So this is because they have a special problem, which is misrouting of the optic nerve fibers. Normally, the two optic nerves, part of them, they cross and then go to the other side of the brain. In this oculocutaneous albinism, most of the fibers, they will cross and go to the other part of the brain, and which is very pathognomic. And as you mentioned, what test can be done. So in those patients who have a tricky diagnosis, like in patients who belong to a fair family, then it is difficult to differentiate, oh, this child is having nystagmus, but all the parents, everybody is fair in the family. Is it albinism, or is it, just other kind of nystagmus? This detection of this optic nerve misrouting of fibers, which can be done through visual evoked potential or VEP testing, can be, the diagnostic test for confirming oculocutaneous albinism. So these are the eye problems which they have. Mainly it is a shaking of the eyeballs, the strabismus, and the poor vision because of the fovea not being formed of foveal hypoplasia. Apart from that, yes, the pigment is not there. So the iris or the black portion of the eye, it would be, light colored, as Dr. Gunjan mentioned. And when light is shown into the eye, the light reflects back and comes out through the iris, which normally doesn't happen. So you see that, black color disc, which is the iris, there it transilluminates, or it shines like, red iris becomes. So that is important. And in the retina also, there is not much pigment. These patients have a lot of photophobia and glare because of that. Because retinal pigment is not there, iris pigment is not there. A lot of the light which is blocked normally in patients, in normal people, is not blocked in them, and they have a lot of glare and photophobia.
So we have also talked about some stereotypes. Now let's talk about some myths in regards to the treatment, in regards to the problem in general that people hold, or to regards to the treatment or diagnosis of albinism? Are there any myths to bust?
Basically, there are myths not only with albinism, but myths are associated with any disorder. There are myths associated with leprosy, which also involved having hypopigmented patches on the skin. There are which is also known as Kusht Rog in Hindi, and we all know that these people are, we can say they work sometimes as a beggars because there are no job opportunities for them. Similarly, sometimes with white skin individuals, they sometimes can face some professional rivalry and some dehumanizing and derogatory terms has been used by some people, they are called as white monkeys. So these are some very, I would say, bad and terrible terminology that we should train our normal people. We should not say these things who are suffering from albinism. It may lead to some, emotional setback to the child. He may stop going to school. He may, because there is as such no difficulty, there is as such no disability in them that we should stop sending them to a normal school. Except for the child is suffering from strabismus or nystagmus, which can be treated by an ophthalmologist. As far as regarding skin is concerned, there is as such no thing that we should prohibit them to going attend a normal school to them. So they can live their life fully and they can enjoy their life fully. And regarding their marriage, when they will become adult, definitely a genetic counseling, a genetic testing is needed so that they cannot transmit the disease to their progeny, because there is 1 in 4 chance that if two recessive, basically 2 copies of the gene is required for a child to have albinism, 1 from mother and 1 from father, because it's a recessive trait, simple. So there is 1 in 4 chance your child will get albinism, but there is more chance that you will not carry a gene. There is 1 in 2 chance that you will be carrying a gene, but carrier doesn't mean that you will have a phenotypic appearance of the disease. Carrier means if you will marry a carrier and you will get the gene on the 2 gene from in the same locus, then you will only get the disease. So all this is done in genetic counseling, and there are the myths which are prevalent in the India, Africa, and all over the world can only be done by support of people. Support groups should be formed, I would say, and we can encourage them to join them.
Going to a normal school is really difficult for these children, especially with type 1, because they will have vision problems. So they would have to have some assistance from their teacher. Even if they go to a normal school, they should be seated on the front benches. And even then, if they have difficulty, then they will have to be given telescopes. I think the part will be experiment of Shailaja. We will have special lenses which will be given to these children, or even using a magnifying glass will be helpful to them to read their books. So getting absorbed in the normal school, the school will have to adapt to these children. Definitely,
with special cares, they can definitely go for a normal schooling.
Yeah. So with this vision aids, they can go to a normal school, and yes. So and the other fact is that one albinism always, most of the time, marry another albinism. So if they are if there is a couple with albinism, then they would have a question whether the children will have albinism. So if the couple have the same type of albinism, say OCA type 1 marries another partner with OCA type 1, then all their children will be affected.
Yes.
All children will be affected. Then their risk is not 1 in 4, but all the children will be affected. But if OCA type 1 marries OCA type 4, then all the children will be normal. Because there are 2 different types. So each person will give the normal gene of the other type. So if OCA type 1 marries OCA type 2 or OCA type 3, then all the children will be normal. So basically, this is important to know because this is a recessive syndrome. Yeah.
Another thing which needs to be, like you asked about myths, right? So this disorder, because it's autosomal recessive. Recessive means, as he has mentioned, that both copies have to be defective for it to manifest. So it is more common in families who have consanguineous marriage.
Yeah.
That means marriage within the family in relationships. So in them, it is more likely that both the parents or both the people who are getting into the marriage may have that same genetic pool and have at least one copy of them being inherited, and then one child will have it. So it is important to, and as he has mentioned, it's more likely that because that child has a problem or the patient has a problem of not able to see properly or having a disability, they tend to get married again within the same family because they don't get accepted in other families. So that thing gets compounded. Every generation it will get compounded, and that is how the cycle doesn't break. And so it is too important to make the people realize this, and at least go for a genetic testing. At least both types should not be the same, and if not, then at least not try to marry within the same family. That is another important message that patients should get.
Another interesting fact is that there are certain types of ocular albinism which are more common in certain countries. Like in India and in the world over, OCA type 1 is the commonest, but in Japan and in Korea, type 4 is almost as common as type 1. So type 4 is SLC45A2 gene. So that type is almost same as type 1. Even in South Africa, where albinism is the commonest genetic disease. So the commonest genetic disease in India is thalassemia in single gene diseases. But in South Africa, the commonest genetic disease is albinism. So basically in them, their type 3 is more common. Type 3 is a gene called as TYRP1 gene. So that gene is more common. Similarly, in Pakistan, they have found a new type of albinism called as type 5. And in China, they have discovered another type called as type 6. So there are certain interesting demographics. Also, there is a country in Puerto Rico, there is type 1 HPS1, Hermansky-Pudlak type 1 is very common. Say that the risk, the incidence usually is 1 in 10, 20,000 for other types, but there in Puerto Rico, the incidence is in 1 in 1,500. So out of 1,500 people, one is affected with Hermansky-Pudlak type 1. So these are the facts because they are distributed among different countries in different prevalence.
Now talking about the specifics of eye complications associated with albinism, what are some of the complications that you can shed the light on?
I already mentioned, the most common thing is refractive error. Refractive error means eyeglasses power, and the next one is nystagmus, which is shaking of the eyeball. Third one is strabismus or squint, which is crossing of the eye or misalignment of the eye. Apart from that, as a part of the disease, we have foveal hypoplasia. That means the retina center portion, which is the fovea, which is the seeing portion, is not developed properly. Sometimes they even have optic nerve problems, in the sense optic nerve or the nerve which takes the vision from the eye to the brain is not developed completely. And also the optic nerve fibers, they cross in an abnormal manner, and because of which there is difficulty in binocular vision or stereopsis. That is the 3D vision which is there. So quite a lot of problems in the eye. All of this is surmounted by the problem of photophobia, which is because there's a pigment which is not there in the iris to block the sun rays, and also in the retina to absorb the pigment, so it kind of gets reflected. So a lot of glare and photophobia these children are having. So all of this kind of compounds, and the visual acuity of the vision, depending on the OCA type, can be maybe 6/18 to even blindness category, that which is less than 3/60. So it depends upon the OCA category. The severe ones have worse vision. So these are all the complications that can happen.
I was saying, can the eye related complication be cured over a period of time?
Not entirely cured. Some of them cannot be cured. Some of them, yes, like strabismus can be completely cured or treated by surgery. But nystagmus, the foveal hypoplasia, the misrouting of the nerve fibers, these are all structural problems, and we cannot cure it. But yes, with treatment there can be improvements. Like the shaking of the eyeballs or the nystagmus, it naturally also improves with age. And with time, as the shaking will reduce, the visual acuity will also improve. Okay. Apart from that, when we give a glass power, which is the accurate glass power, and there is focus on the retina, that also kind of dampens the nystagmus or reduces the nystagmus. Okay, so first and foremost, any refractive error that needs to be corrected. Whenever we are giving them glasses or otherwise also there's no glasses, important to treat them for that photophobia. Now for the photophobia thing, two things can be done. One, environmental modifications. Like in the house, you can have dim light, don't have very bright light in the house. When you're taking out the child out, you can use sunglasses. Now in sunglasses also.
Maybe we can take another questions in the meantime. Coming to Dr. Parag. Dr. Parag, how genetics play a major role in reducing the risk of albinism at an early stage?
As it has been mentioned that if there is a family history of someone having albinism, then the commonest question is that this couple comes to us and they say that they have already one child with albinism, or they have a family member with albinism, and they want to know whether their child will also be having albinism. So in such situations, it is possible to screen the partners whether they are carriers for albinism. So if anybody is a carrier for albinism, if both the partners are carrier for albinism, then there is a 25% risk that their child would be having albinism. So they would do something called as prenatal diagnosis or pre-implantation genetic diagnosis. So what is prenatal diagnosis? Is that at 3rd month of pregnancy, they can do an antenatal DNA test. If there is an antenatal DNA test which shows that both the copies of the child has a mutation, then beforehand they would come to know that they have a child with albinism. So then it is legally possible whether the parents, if they want, they can discontinue the pregnancy, or if there is a option that yes, they would also want to continue the pregnancy, they can give birth to the child and treat the child with albinism. So parents can know beforehand whether their child is going to have albinism or not, and they have a reproductive choice. Coming to pre-implantation genetic diagnosis is doing a test tube baby. If they do a test tube baby, they can do the screening of the test tube babies before implanting the test tube babies, and then they can implant a normal embryo and they can have a normal child, and they can have a child without albinism. So this is the way they can do prevention of albinism by using prenatal and pre-implantation genetic diagnosis.
Dr. Shailaja, you can add now your points that you were mentioning.
I was talking about the treatment part. So as I mentioned that, correcting the glass power or giving the glasses only itself, it can reduce the frequency and the dampens the nystagmus or the shaking of the eyeball. And over time, if they develop strabismus, or as I mentioned, that can be corrected. It at least improves their stereopsis or the 3D vision, and improves their, the ambulation across the tasks, the ability to do tasks, day-to-day tasks. Apart from that, the nystagmus, as I mentioned, cannot be completely cured, but along with nystagmus, they do tend to have an abnormal head posture. What is abnormal head posture and why is it that? Because when the eyes are shaking, there is a point where the shaking is minimum, which is called as the null point or the null zone. Okay, so the child tries to, or the patient tries to keep the head in that null zone so that the visual acuity is better because the nystagmus is less. So because of that, they will have a weird looking head posture, maybe a chin up or a chin down or a face turn, and that needs to be treated, which can be treated by eye muscle surgery. So correcting that helps in two ways. One, it again brings the position of the null zone or the minimum position of the nystagmus to the primary position. So the visual acuity or the vision in primary position increases. Plus, the child is able to see through the center of the glasses. Otherwise, you would be looking like, like a side from the side of the glasses, which again further improves the vision if he is looking through the center of the glasses. Additionally, even neck problems will not happen. So these head postures can be corrected by muscle of surgery and should be done whenever it is appropriate for the child. Last thing which can be done for the treatment is that giving them low vision aid, as Dr. Parag was also mentioned, and guidance. Even in the school, there can be environmental modifications. They can be given extra time. They can be, the lighting should be such that it should not fall directly on their eyes, but falling from the back, so that the textbook which they are reading is well illuminated, but they are not getting glare problem. As I mentioned, sunglasses, when they're going out, these sunglasses could be or they could be tinted glasses. They could wear tinted glasses even inside the house where there is, bright light. So these can help them to gain more contrast acuity. The pictures or the books which they are reading, they could have a contrast acuity, which is, high contrast books can be there. They can use the closed circuit TVs for magnification. These are some of the low vision aids, dome magnifiers, or reading magnifiers. All these illuminated magnifiers can be used. So a lot of low vision aids can help them, and actually we have discussed before that these can actually help them to shift them from blind schools to even main schools or mainstream schools, because their vision improves with this and the capacity. And not to mention, children with albinism have good mentation. They have no other problem in understanding, in their cognition. So they're absolutely normal children otherwise. And only problem is that vision, which is also, we can improve that by giving them this low vision aid and rehabilitation. So rehabilitation is a very important part, which I want to stress here.
My next question is to Mr. Dr. Parag and Dr. Gunjan both. Can one reduce the risks and effects of albinism using therapies? If yes, what are the therapies currently available to the patients?
I will talk regarding the skin part. And as Dr. Shelja said, all the protective things, protective gears, they should use to protect their eyes. Similarly, for skin protection, what they can do, I'm going to emphasize on those points, because as such, there is no drug. Since it is an inherited disorder, it is a genetic disorder. As such, there is no drug to treat them. So what we can do, what we can advise them to have a very good sun protection. So sunscreen are very, very mandatory, and physical sunscreen especially. So what physical sunscreen they should use with the high SPF factor. SPF is sun protection factor, and they should also be having a sunscreen which is having a good PA factor also. PA factors basically tells us how much UV radiation, UVA radiation that sunscreen is blocking. So it should having a 3+ PA factor, and with the good SPF like greater than 26 to 30 or 40, even 50 SPF are available. So what is SPF doing? They are telling us to how much UVB is prohibited from this sunscreen. So we should advise them to apply sunscreen in a good thick amount with a good 1 fingertip unit for face, 1 fingertip unit for their neck and all the exposed area. Within 2 hours, sunscreen effect may go. And if they are out, so they should apply sunscreen again, because they are, as I said previously also, there are more chances their skin to get burned. So sunscreen is very important. They should wear clothes properly, full clothes. Broad brimmed hats are very important. They can wear sunglasses with a good UV protection factor, not the local sunglasses. So it should be a good one. Thirdly, they should avoid going in the peak sun hours. Around if like in Delhi, in North India, summers are on peak. If they go out like around 12 noon, 1 p.m., this is the peak sun hour, and there are more chances to get more burns in these hours. So when there is less of sun, there is shade time, evening time, they can go out for their normal activities. And secondly, they should avoid going in very high altitude areas, because there is a if they go to beach area, there are more sun rays, reflecting sun rays from ice in the snow peak mountains and from the sea in the beaches. So it may affect them more. So sun protection is very, very necessary. And as Dr. Shelja said, as they are sitting in home and doing some usual work, doing their homework or doing whatever, we should keep the room light to very minimal, normal level. It should not be very bright light. It may affect your skin, because a minimal amount of UV radiation is present in our tube lights also. So if anybody is suffering from those things in which UV and UVB sun rays are involved, and they plays very important role in disease prognosis, and maintaining a good lifestyle, then we all, not only in albinism, in other skin disorders, we also advise to put sunscreen even when they are at their homes. Even there is a cloudy weather, if we do not encounter sun rays directly on our skin, then also you have to apply sunscreen. So sunscreen is a must go for them. So this is the protective things, and these are the therapies only, I would say. And then regarding genetic, and secondly, in few types of oculocutaneous albinism, except for OCA1A, in which there is completely no pigment, there is small amount of pigment sometimes we see in the arms, in the legs and trunk, in other type of albinism. So there is a surgery, non-melanocyte, non-cultured melanocyte suspension, in which we take out the cells, we make a suspension from them, we extract out all the melanin, all the melanocytes from them in a higher number, and then we put it as a graft on the other side. So if someone wants them, these are under trial for these kind of inherited disorder. These are not the recommended therapy, because this is a recommended surgical therapy for other autoimmune disorders like vitiligo, where we know the exact causes, and we have enough studies, we have do enough work. These are our regular treatments. But for diseases like albinism and other associated syndrome, this non-cultured epidermal suspension is still under trial. Few studies have been done, but I'm just not emphasizing over it, but I'm just saying that this is an option for us in future. We can think over it.
Dr. Parag, would you like to add something to that?
Therapies are all mainly preventive therapies. So there is no cure for albinism as of now. So, so prevention of sunburns, prevention of cancers, because they have to screen themselves regularly for skin cancers. So what are the various skin cancers that can occur in albinism? One of them is melanoma, which is the skin cancer of the melanocytes. Then there could be squamous cell carcinoma. Then there could be something called as basal cell carcinoma. So all these cancers need to be screened early, because if they spread and if they metastasize, then if they're detected in advanced stage, then they could threaten the life expectancy of these individuals. So it is very important that despite the preventive measures, there could still be a high risk of cancer. So, and regarding the prevention aspect, I have already said. So prevention is almost as good as therapy. So prevention of transmission of genes, as discussed with pre-implantation genetic diagnosis, then there could be very well adaptation by these families to avoid to transmit the gene to their future generations.
Again, another question from you, Dr. Parag. Does albinism skip generations?
So yes, albinism can skip generations. Especially, we have seen many families that it is possible that it could be present in carrier stage. So if carriers are totally normal, they are like you and me. So carriers have normal melanin pigment. But when two carriers marry, then there is a chance of having 25% chance of having child with albinism. So then there could be possible that some generations might skip because they are just carriers, and the next generation might be affected. Yeah.
Is it more common in a specific gender, or it is neutral?
It can occur in both genders, but there is an X-linked form which occurs primarily in males. So that is called as ocular albinism. So there the mother is a carrier. So so father is not a carrier for the gene, because X chromosome is transmitted from the mother to the boys. So because Y chromosome is from the father and X chromosome in the boy is from the mother. So X chromosome is only in a single copy in the male. So if that has a mutation, then the child will be affected. So except for X-linked autism or X-linked albinism, the other albinisms are mostly recessive in nature, autosomal recessive. There is a form called as autosomal dominant albinism called as TIDZ albinism deafness. So in TIDZ albinism deafness, there is in addition to albinism and eyesight being little low, there may be deafness. So in there it is dominant form. So there it would be from one generation to the other in a dominant form. So there it is not possible to skip generations because it is a dominant type of a mutation.
What do you think is the most prevalent form of albinism which is found in India?
So OCA type 1 is the most prevalent type of albinism, and the commonest mutation which is found in this patient also is R278X. So when we do a DNA sequencing, we found that the 278 position of the TYR gene, there is a stop codon mutation. So this is a very common mutation, and it is one of the commonest forms of albinism in India. In OCA, there are two types, type 1A and type 1B. So type 1A is the commonest gene, more common than type 1B. 1A is more common than type 1. So 1B, these patients tan with age because they have some amount of melanin pigment. So when the age increases, there could be more pigmentation of the skin and the hair. But OCA type 1A don't tan.
With albinism, there is a lot of social pressure. There's a lot of mental pressure involved with the people who have this condition. So I want to bring this question to Dr. Shailaja and Dr. Gunjan, that these children need a support from their families, from their friends. So how does one provide that support to children having albinism?
First and foremost, it is important for the patients to accept that this is a problem, and whatever we can do to improve it, we are doing it. Okay. So many a times it is, as I mentioned, I've seen families where they're just so happy that they have a, fair looking child. And when you say that, and then they come up at 3 or 4 years of age when the child is having visual problems, and then they say, oh, why is this visual problem there, why is he having this nystagmus? And we say, oh, because there is no pigment in the body. And it comes as a shock to them that what they were thinking as a, as a boon or as a good thing in their child is actually a problem. So coming to terms with that and accepting that. Second thing I would say is, genetic counseling and preventing these things to happen in the family. Then for the same child, it is to make the child as capable as possible to be, in a normal school. At the same time, the parents have to be first, or, all the support comes from the family first. The parents and the immediate family members have to be counseled to be, accepting the situation and not, blaming the child or blaming him for, having a problem or a disease, which is more common here. Ki, "Arey, tera to, your eyes is like this, your eyes are like this only, you can't read. Why are you?" So it begins from home first. Secondly, what we try to do is that link them with other families. I think Dr. Gunjan mentioned that patient forums are there. I think there's a very good active Facebook group which is there, Albinism group on Facebook, which is linking people and, dealing with them. Many of them do develop depression as they grow older. I mean, children, it is not that much because they are, busy playing and things. But as they become older, they're not getting jobs, or they are, out or standing out or away from, from the rest of the peers when they're different. They have restrictions. They can't go out quite often. They have to wear these glasses. They have to, their eyes are shaking. They can't see well. So they develop kind of depression when they grow up. So then linking them to these forums and, even suggesting them a little bit of psychological or psychiatric counseling, it helps.
Yes, and definitely this is and presently people are blogging, and most of the, and we should also say some influencers on YouTubers, we say these days. So they can also help to create awareness regarding albinism. We can encourage them to join peer groups on Facebook, Twitter, and whatever social media channels they are available. And also some NGOs can also help to spread the awareness. So all these things are will be need of the hour, I would say.
So I want to touch upon the mental health issue that these people with albinism go through. How do they should channel it in themselves, that accepting it and thinking that it is normal, and whatever other people are telling them, mainly it should not affect them.
See, it is a very long and steady process to accept it that you are having albinism, okay, and you are suffering from, you're actually living a normal lifestyle, to understand the disease prognosis and its clinical course, to understand you are not suffering from, if you are having any skin lesion, so what are the danger signs. So basically, all these things we have to train them from, we should train them from their childhood, so that things may not become worse when they become adults. And secondly, I would say if there is some mental setback, if they're not getting jobs, like in other hypopigmented disorders like leprosy, which is much more prevalent in India. Okay, so there is, we see regularly patients of leprosy very, very much, and we often found that there are lack of job opportunities for them. Similar things may happen with albinism people, and definitely we should be encouraging them, and there should be rules, there should be, there is right to every individual. UN has formed some groups on social media as well. Those people, children can join those groups, and their parents can join, and we can train them from their childhood only.
Touching on the awareness factor here, you've all mentioned various initiatives that are working right now. I mean, are there any more initiatives that are that are right now being worked on the ground to spread awareness for albinism?
In 2013, there are some in United Nations. And from 2014, United Nations announces. After that, they noticed some derogatory remarks on albinism, that being called as albino and white monkeys. So some firms have been formed by UN. So from 2014, it has started we celebrating as 13 June as International Albinism Awareness Day. So definitely they have formed some norms all for all over the world, which is to be followed since it is by United Nations. So there is all the right to speech, right to have all the jobs. So basically children and their parents should have knowledge about it. So these are the awareness group, and definitely Indian government definitely can, or NGOs or some uh, peer groups can form such groups, and they would be really beneficial.
Dr. Shailaja, would you like to add something to that?
Yeah, so when we do the genetic counseling and counseling of these patients, like we try to link up with these groups, as I mentioned. So in India, as I mentioned, there is a Facebook group which is quite active, and we quite recommend them to them. And the same group, they have a Jeevan Trust. It's something called as a Jeevan Trust, and they help to connect with these people and spread more awareness about this. It's a very nice activity which they are doing. This Jeevan Trust is doing for albinos all across India. So
Right.
we try to link our patients to them, and although I would say that when children, I deal more with children, I don't see them taking up these things so easily. Maybe when they grow up, they'll be here because the parents have to have that awareness and then connect it. It is I think more important for the parents to realize what is there in store for the children and to be supportive from the very beginning. So I counsel more the parents more as compared.
How do you, Dr. Gunjan Verma, how do you counsel patients suffering from albinism?
Definitely, we will counsel, first of all, genetic counseling as we discussed in all our panel discussion. That is really very important. That is the first thing. Then second, eye protection that Dr. Shelja has told very clearly and very properly about it. And third, foremost important, the skin protection. We, as I told before, like sun protection measures, broad brimmed hats, UV protection from sunscreens, wearing full body clothes, and to know the danger signs of any skin cancers like any growth, any lump, any change in the growth, any dark color growth, any discharge, any pus, any blood, any if their growth is increasing in size over a very short period of time. So all these things we should ask them to know about it so that they know what are the danger signs and they can come for an annual checkup for their dermatological and skin examination. So these are the things that we need to counsel and help patients suffering from albinism and their parents.
To conclude this conversation and to throw some light and on the optimism side of this conversation, do you all think that there will be a cure for albinism in the coming future?
Yeah, that's a good question, Shivam.
There is a lot of research in gene therapy going on. So, of course, there have been definitely gene therapies for certain diseases, although it's very expensive, but definitely there is a hope. There is also a technology called as CRISPR technology, which is one of the latest gene therapies.
Yeah.
So there is hope that there could be gene therapies for autism in the near future.
As he's saying, animal studies have been done with CRISPR technology and also with the adenoviral, and also some other like L-DOPA supplementation, nitisinone. These are some drugs which have been used, but unfortunately, when they have been used in adult albinos in humans, they don't work. So probably the timing of the initiation of the treatment is important here. You have to initiate the treatment in whatever way in the newborn, in the neonates. So when that can happen, probably there'll definitely be a cure. This is what I infer from whatever
yes,
research has been done.
Yes, definitely gene therapy is the foremost. And regarding skin, if we can do melanocyte grafting, which is also under research for albinism, if that can also help us with the disorders of inherited hypopigmented, which are inherited, that may also help in the future.
Okay. Well, thanks to each one of you for joining in. And I hope we all have learned, and all our viewers have learned a lot about albinism today. And certainly, there are a lot takeaways that we can take home. And I hope it mitigates the stigma around albinism and the discrimination that goes around in our society. So thanks again, everyone, for joining us. It's been lovely hosting you. I hope we meet again in the next year or in the following segments or the following panels in which regards to albinism. Thank you all.